One of the major projects that the George Centre for Healthcare Innovation is embarking on is a study of 1 million teenagers in India. We're very interested to find out what are their healthcare problems, the characteristics of Indian teenagers who have health problems, and look at how they access healthcare so that we may in the future determine ways in which we can improve their healthcare and essentially, because they are the citizens of the world, improve the health of people in India generally. Well, at this point in time, I think we're aware, some of the research is suggesting that we're likely to find a number of teenagers have significant mental health problems. We're aware that suicide is a significant problem amongst Indian teenagers. We also believe that there'll be issues to do with road traffic injuries, a major cause of morbidity in Indian teenagers. There will likely be reproductive and sexual health problems. So we're going to look at some of the health conditions that affect those teenagers now, but also look at some of the behaviours and environmental factors that may lead them to develop chronic disease problems in future. So for example, we're mindful that there's that transition from young people from undernutrition to overnutrition, so increasing levels of obesity, for example. So we want to try to look at what are some of the factors that might be associated with future chronic disease. I would hope within 10 years we start to see some very useful findings. We start to have a clear understanding of what are the health problems of adolescents in India. We start to understand how they can access health care. We start to understand how we can intervene to improve prevention services, to improve healthcare management services. We believe that the sorts of findings we'll produce in this study should have implications for how we provide healthcare services for adolescents more broadly outside India and indeed globally.